Hi, good morning, good afternoon, depending on what time of the day it is. When you open this video, my name is Royale, but most call me Nurse Brown. I have been a nurse for 4 years. I have experience in pediatrics, which is also my favorite age group to work with. It's a lot of fun. The kids keep you on your feet, keep you young, and keep you moving. Currently, with the contract that I'm working with, I work with elementary as well as the combined school of the Early Childhood Center. With the Early Childhood Center, the children range from 3 to 5 years old, and the elementary school, they are from kindergarten to 5th grade. So the school is combined, so it's very busy. We see students who have an active diagnosis of asthma. We see diabetic students, and we also, administer medication to students who have an active diagnosis of ADHD. So with this school, there's not a lot of skills, but we do see the asthma students. We're doing respiratory assessments as well as administering inhalers per the doctor's orders. With our diabetic students, we're just making sure they are safe, making sure their sugars are within the normal range, and we are administering insulin as, per the doctor's order. We do have students who have, severe allergies, so we are administering EpiPens per the doctor's orders as well. And we get the school visits throughout the day, and we just triage accordingly to the students' needs. We get a lot of students who have injuries, so we are, doing a lot of wound care. With the school I worked at previously, I have 6 months of experience there. That age group was from kindergarten all the way to 6th grade. School is very big, so also very busy. So with that age group and that school setting, we would service the children in their classrooms. So if they required a G-tube feeding, we would administer it and perform the service in the school. If the G-tube student, required medication, we administer the medication in the G-tube as well, along with the feeding. We would go to classrooms as well and administer medications. And yeah, so peds is my passion. I absolutely love it. I always tell people children may not remember everything that you say, but they remember how you make them feel. Their minds are very impressionable, and I just love, being a part of their growth and development. It's very rewarding to see them, how they started off in the beginning of the school year, how they, grow, they develop, how they mature, they, gain all this wisdom. I absolutely love it. So again, I absolutely love it. Again, children remember not just what they don't remember what you say, but they remember how you make them feel. And I'm honored and, just glad to be a part of that.